If you're interested in the topic of periodontal disease, it may be that you're experiencing some symptoms. For most people though, they don't even know that they have periodontal disease. Their gums may be slightly swollen, maybe red, maybe bleeding, but the surprising thing is that oftentimes periodontal disease is actually almost painless. Now that doesn't mean that something isn't happening. What actually happens is that the support for the tooth is actually going to be eroded away eventually. The leading cause of tooth loss in adults is not from decay or having teeth extracted, it is from periodontal disease that actually softens up the support around the tooth, and that's the leading cause of tooth loss. So it's a very, very important thing. Another thing that's really interesting that's come out since 1998 is that the fact that periodontal disease, even though it's a low-grade infection, causes inflammation in the body. Now what inflammation means is just like you would have a thorn in your thumb and your thumb would get inflamed around that thorn, you get an inflammatory response from the presence of the bacteria in the collar of gum around the tooth. So the negative about this is that it can cause other disease processes to become worse. If you have diabetes, the diabetes will become worse quicker. The other thing that can happen is that, for instance, if you were to have cholesterol in your blood vessels and you have an inflammatory response to the bacteria in your mouth, this inflammation causes a release of prostaglandins and other chemicals into the bloodstream that can make this cholesterol area break down. When it breaks down, it can bleed. When it bleeds, it has to clot. If one of those clots then breaks off and goes to your heart, you get a heart attack. If it goes to your brain, you get a stroke. So there's a lot of health implications with periodontal disease. So the end result is that it is a very, very important thing for you to treat. I like to say this, when I'm trying to restore somebody's mouth, it's kind of like fixing up the gums and getting things healthy there is almost like getting the basement of a house fixed up before you remodel. There's no sense of remodeling unless the basement's in good shape. And the gum is the support for the tooth, so we want to get the gums healthy. So it's important for your health, and it's important for the stability of dental work and for keeping your teeth for a long time. So how do we treat gum disease? In the past, the standard of beginning care was scaling and root planing. And what scaling and root planing accomplishes is getting the tooth surface clean, getting the toxin layer off the tooth, getting calculus, buildup, anything that's on the tooth off of the tooth. In addition, today what we tend to do is to use laser technology. We use a diode laser to go into the cuff of gum around the tooth, and what this laser enables us to do is it enables us to go in and decrease those 300 to 500 types of bacteria in the mouth to decontaminate the area. And the laser fiber also makes diseased tissue stick to it. So we can, with that laser fiber, wipe through the collar of gum around the tooth, and the laser will selectively pick up the diseased tissue and leave behind the good tissue. All this in an effort to get your body kind of a kickstart towards healing. In addition, for those who have more advanced gum disease, other treatments such as surgery and other things may be needed, but hopefully we'll be able to get to things early enough that the disease process can be brought under control. The other key component for controlling gum disease is your own home care, and we'll be glad to show you how to brush and floss and use toothpicks and different appliances that we can use to clean your teeth effectively. So in summary, I'd like to say that treating gum disease is one of the top priorities for a healthy mouth, and we'd be happy to come up with a treatment plan for you to keep your gums healthy.